We, as an entity, started about 2005, 2006, and I started here back in 2007. Back then, in this region, we had a national shortage of urology in general. And in this region, not having a training program was quite detrimental because the workforce in about 50-mile radius was 50 and older. With intent, we started building a program and started bringing in core fellowship trained people. Intentionally, we went after fellowship trained people who were, number one, good human beings, two, incredible technicians, three, came with a pedigree of good training organization.
Here at Erlanger, we have multidisciplinary care. We do offer nerve-sparing retroperitoneal lymph node dissections, so focus on advanced kidney cancer and offering cable thrombectomies, and of course a large portion of my practice being in this state with a large population of smokers is treating bladder cancer, and so offering cystectomies and not only the more common ileal conduit, but continent urinary diversions as well.
We have a group of surgeons here who are close-knit, who are able to communicate well with each other, who are always interested in helping each other, and who are, I think, hungry to improve the care for our patients. And because of that, I think we are able to get patients in and through the process faster. We provide the best care available because we're not scared to work through things with our partners and to share the burden that comes with the care of patients with each other. The vast majority of us are fellowship trained, coming from a variety of diverse fellowships all across the country. They bring the skills here to a town like Chattanooga and provide that care to the folks in the region.
It's a team. I always say it takes a village to take care of patients.
What we provide is truly special in the world of postgraduate training for urologists. The fellow is exposed to all elements of robotic surgery in the field of urology. We cover every aspect of oncology. We cover lots of reconstructive urology, and we also are one of the few programs that's offering full training on the single port robot. This is not a fellowship where the fellow is just an extra body. I mean, they are busy, they operate, and I know the people we've put out into the community have been real happy with the training they've gotten.
Next generation, I want to teach them at the same level that I was taught by, so going back to its original roots and foundations. If you know the fundamentals, you could do anything. And that's basically the bottom line.
Analogy I use to explain to people is if you have a rotten area in a fruit in one corner, why would you throw away the whole fruit if you can salvage it? That concept has changed the oncology world in all specialty. The area where we were lagging was in prostate cancer. Prostate cancer, no matter what kind of disease you had, either you did nothing or watched it, or you went through where you did a radical prostatectomy or a whole gland treatment. Then the whole concept of focal therapy came about, especially with robotic HIFU system with Focal One, which allowed us to fuse the area in real time and treat with a margin in just a localized area of prostate. Furthermore, we also have incorporated nanoknife, which is a technology uses electricity to basically ablate tissue. It's athermal. So we have a whole program focused on focal treatment for prostate cancer.
We have a wide-ranging treatment options for female urological problems. For instance, when it comes to incontinence, it can be as simple as getting a pill to correct the overactive bladder. We do offer advanced therapies such as sacral neuromodulation to correct overactive bladder as well. We offer surgery for stress incontinence. That includes placement of a bladder sling, or it can be a simple office procedure like injection of urethral bulking agents, which is minimally invasive as well. So it can be a wide range of treatment options, and it's suited for the patient's lifestyle.
As a men's health specialist, there's a dearth of clinical and surgical knowledge about some of these issues. Quality of life issues for men, we feel, are underreported across the board, specifically with erectile dysfunction and potentially urinary leakage that men suffer with. And so there is a lot of work to be done in that regards. Most of our research is based on minimizing infections associated with penile prosthesis and urinary prostheses, things that we do to help return erectile and urinary function to men who have lost it as it relates to cancer care.
Certainly our number one goal is always to provide exceptional patient care, as it should be for any physician, but I think a very close second for us is trying to train very capable urologists to treat the next generation of patients. And we're lucky here we get to do both. I think a good fit for a resident looking to join our program is someone who wants to get exposed to the full breadth of urology. We see everything from, very simple cases all the way across to the most complex patients that you can imagine. We also have faculty trained in each subspecialty fellowship area of urology, and that is a unique feature of our program.
I went to residency here from 2016 to 2021. Very busy, very growing time. It looked very different, from the early days when I rotated here and started to how it did when I graduated, and it's grown. It's doubled in size actually even since then. The current residency program is still growing. In the next 2 years, we will have a full complement of 10 residents, which is 2 per year. They are integral to everything we do here. They're in clinic with us, they do procedures with us, certainly do surgeries with us. Our patients are gonna see them in the hospital, often the first face they see and the last face they see from the physician side of it.
The hope for future is to build on what we have. It's easy to get to success, it's harder to maintain. The good thing we have is that most of our colleagues, we are all young, so there is hunger to do the next best thing, hunger to what's in future. Our goal is to reinforce what we have.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.